Good morning, everyone. I think we have got an excellent topic as a plenary uh, lecture, and compassionate surgery. And compassion is something you have to show every human being, not only to the patient. Not only to the patient. So therefore, to talk about it, we have got a very eminent speaker, Professor Jackie Taylor, who had been the past president of the Glasgow College, and my colleague Jayendra will introduce her to you.
Yeah, Professor Jackie Taylor is the immediate past president of the Royal College of Physicians and Surgeons of Glasgow. She's made several visits to our country and has been very closely working with us, particularly to obtain the MRCS for our postgraduates. And she's a very warm, interested in our activities of the college. And it's our great pleasure. She'll be speaking from the UK because she was unable to travel here. And she's joining us online, but we will have her presentation recorded. So warm welcome to you, Jackie, and we'll have the presentation now.
Good morning, everyone, and I'm delighted to be with you. My name's Jackie Taylor. I'm past president of the Royal College of Physicians and Surgeons of Glasgow. So good morning from a very rather damp and cold Scotland. It's almost a year ago since I was with you in person, and I'm really sorry that I'm not able to be with you personally today, but I hope that you'll find what I have to say interesting. Some of you may remember that last year I spoke about the importance of caring for our profession. And I touched on the importance at that time of compassionate leadership. So today I hope to elaborate a little more on what I think leading with compassion is. And I hope you can take something away from this that you can use in your clinical practice. It's certainly a very great honour and privilege to have been invited to speak to you again. So over the course of the next 20 minutes, what I hope to do is just to think about why we need compassionate leadership at the moment in particular, what compassionate leadership actually is, and to show you what the benefits are for really all who are involved. So where are we at the moment? Well, the current backdrop is, to say the least, rather challenging. I'm sure every generation thinks that their generation is facing the most difficult of times, but I do think we've got quite a unique set of circumstances at the moment. We have rising demand and expectations from our patients as technology develops, and more is possible, more and more is expected. At the same time, we have changing in our demographics and aging population across the world, an increasing complexity and comorbidity of patients. We have, of course, faced that global pandemic, which has truly impacted and continues to impact on healthcare. We have ongoing problems with culture in the workplace, a global healthcare workforce shortage, and the most important and worrying of all crises is that of global climate change. So a pretty unique time that we live in. The pandemic in some ways may be over, but the impact is not. I'm just going to share with you over the next couple of slides some data from the current status in UK. So within NHS England, the current backlog of people either waiting for procedures or investigations or indeed appointments has for the first time breached 7 million. And you can see the projections for how this is going to continue to be a problem unless we do something fairly drastic. Not just elective surgery and elective medicine, but our acute services are also being impacted on hugely. And headlines like this have become the norm. Pictures of ambulances waiting to drop patients off at the emergency department, corridor medicine, as we now call it, while patients queue in corridors waiting to be seen. And patients are waiting longer and longer for their acute care as well. This all takes its toll on the workforce. These data are from our national training survey this year. And excuse me, in this survey, questions about burnout are routinely included now. Very worryingly, almost 60% of trainees and more than half of trainers face a high or moderate risk of burnout. So the impact of the pandemic definitely continues. These are some data from the Federation of Physicians census, which asked in particular around behaviours of retirement. So 52% of advertised consultant posts are unfilled. And in the vast majority of cases, that is because there is no suitable applicant. We have 130,000 medical and nursing vacancies. Consultants are working excessive hours, and almost half of our workforce is going to reach retirement age in the next 10 years. Consultants are choosing to retire because of their disillusionment with the NHS, burnout, workload, and a desire for a better workforce balance. And all of these pressures within the system and on the individuals result in behaviours that we would prefer not to see. All of us in the right situation, with the right external stressors and the wrong environment, can become incivil at work. And we're aware of the problems of bullying and harassment that continue to be prevalent. Moreover, I think we're very much witnessing in the post-pandemic phase significant amounts of moral distress, and actually the more serious sibling of this, moral injury. And moral injury and moral distress occur when we witness suffering but feel completely powerless to actually alleviate that suffering. When we have to make impossible choices and decisions because we lack resources. When we have an overwhelming workload and we're suffering from physical and mental exhaustion. And also when we're suffering from fear of the unknown. And I think that moral distress and moral injury is ongoing now at a time when the backlog of care is so significant. So what do we do? Well, I think probably one thing we can all agree on is that our healthcare systems around the world require complete transformation. They require innovation and a whole system redesign. And that means radical thinking at times. And of course, you'll all be very familiar with this quote from Albert Einstein, but it is absolutely true that we can't solve the problems with the same kind of thinking. So we need to create enabling leadership, enabling cultures and environments that are permissive for the conditions for change. This quote by the Dalai Lama, I think, does speak volumes. So when we're motivated by compassion and wisdom, the results benefit all of us, not just the individuals. So what is compassion? Well, I think this is quite a nice definition. It's a sensitivity and awareness of suffering in others and in oneself, but not just an awareness, a real desire to alleviate it and prevent it from happening. And it's an absolutely core value within healthcare. All of those who go into healthcare have compassion at the core of what they do. And yet sometimes we find ourselves working in environments where there is a lot of compassion fatigue. So we can feel compassion for others. We can very much experience it and receive compassion from others. And I'm sure you're all aware of just how comforting and enabling that can be. And we can be self-compassionate. And I'm going to come on to that a little later in my talk. I want to mention at this point Professor Michael West. Now, Michael West is an honorary fellow of our college. He works with the King's Fund as a senior visiting fellow, and he's professor of work and organisational psychology at Lancaster University. He has many other roles and has received many awards during his career. And Michael is someone who very much embodies and is the expert on compassionate leadership. I first heard about his work when I was president-elect for our college, when I realised that I was going to be in a very prominent leadership role, and appreciated the fact that perhaps my style of leadership was not your typical command and control. And I learned a lot from Michael's work, and it really supported me throughout my time as president. So what are the components of compassionate leadership? Sorry, I should just say I'm going to draw very much on Michael's work in the rest of my presentation to you. So the components of compassionate leadership, first of all, it is about listening, attending, actually being present with people and listening actively. Listening is not a passive activity. It is a very active one. But it is true that most people, when they're listening, are already formulating their response. That is why they're listening and thinking what they're going to say next. They're thinking on their feet. Actually, to be a good listener, we need to focus entirely on the person and on what they are saying. It is a tiring and actually quite exhausting thing to do well, but nevertheless, it is an essential part of being a compassionate leader. The second thing is not just attending, but understanding. How often have you had a conversation with someone and you've left that conversation and maybe said to a colleague, I've actually no idea what that person was talking about? Well, in that case, the fault is on both sides, because not only do you have to actively listen, but you must take time to explore what is that person actually trying to tell you? What do you need to understand about their perspectives, about their situation? Because only really by understanding that other perspective, by standing in that person's shoes, can you really begin to truly involve them. The third element of compassionate leadership is empathizing. And I very much believe that empathy is the best medicine. So empathizing means not sympathizing, but mirroring that person's emotions, expressing that you understand what they feel. That's a very powerful thing to do, to admit, I have been in your shoes. I do understand, to be able to give an example of something that has happened to you. But we have to do that without becoming completely overwhelmed by the emotion, because if we become overwhelmed, we become much less useful in our own right. And the fourth element is actually having a desire to help. And this is probably one of the hardest things to do. Yes, listening and understanding and empathizing are very powerful things to do, but without actions, then they are less helpful. So sometimes this means providing resources, and that's the most difficult thing of all to do. But actually, sometimes it simply means providing intelligent actions, removing obstacles for your team. So these are the four main pillars of compassionate leadership. But by leading in this way, by definition, we ensure inclusion and participation of the whole team. So leading in this way does ensure that we listen to everybody, and that we listen to everybody and value everybody in the same way. We then create an environment where people feel safe. They feel safe to speak out. They feel safe to give an opinion. And they feel safe to give an idea. This improves engagement with staff from all different perspectives. And by doing that, you widen the pool of expertise that you're drawing on, really allowing co-design and co-development of services and innovation. And taking that to its natural conclusion is to involve patient groups and listen to patient groups in designing our services. Compassionate leadership very much creates an environment for innovation, for that innovative and transformational change that we need to see in re-engineering healthcare for the future. So when you Google, through Google Images, command and control, most of the images that come up are actually military ones. And I guess that comes as no surprise to those of you who have military links and military responsibilities. Command and control is an effective form of leadership. And in crises, it can be a very effective form. But in fact, it is not a format of leadership that can sustain. And I believe very firmly that we are now in a situation where command and control will not be effective. And we need to look at other ways of working and leading. I do want to dispel a few myths about compassionate leadership, things that have been thrown at me over my time. And the first of these is that it's a really soft option. It's all about motherhood and apple pie and being soft and cuddly and not upsetting people. The other myth, one of the other myths, is that by doing this, it is leadership by a team, by consensus, with an approach of mediocrity rather than high quality. Not so. Another myth is that it doesn't allow tough performance management, or that it will just always take the easy way forward and will not challenge the status quo. All of these are myths about compassionate leadership. And actually, what it requires is a considerable amount of courage, because you do have to be prepared to listen and to hear some very tough messages, to truly explore the challenges that people face and understand and empathize, and to be challenged about what you as a leader are doing. It does require resilience, not a word I use very often in my practice, but it does require resilience, and it requires belief that you're doing the right thing. It has to begin with self-compassion, because only by showing and displaying those 4 components to ourselves can we really begin to think about leading others compassionately. So what is the impact of compassionate leadership? Well, first of all, let's think about the impact on staff. So there's very clear evidence that leading in this way improves trust within the team. It generates compassion within that team, and it extends the influence of you as a leader. It improves that shared vision of where we should take our services. And there is clear evidence that people who work in supportive teams have lower levels of stress, one of the things that we're trying very hard to ensure. What about organizations? Well, again, clear evidence base of increased staff engagement. That leads to far better outcomes for the organization, including ability to innovate and transform. And it also improves financial performance. For patients, well, staff who are treated and led with compassion are far better able to care for others. The quality of care is much higher, and there are higher levels of patient satisfaction and fewer complaints and incidents. For those of you who want to explore this a little more, I'd recommend this book called Compassionomics. And you can read this quote back from Don Berwick, but very much this shows that the evidence base that compassion, a simple tool, can improve outcomes for patients and us the caregivers, and organisations. So to meet the needs of staff, we have to provide the ABC. We have to give them autonomy, some control over what they're doing, better working conditions, a sense of justice and fairness. We all need to belong, to feel connected, to feel that sense of purpose and team working. And we all need to feel that we are contributing in the best possible way that we can in terms of education, learning, development, and workload. So in summary, I do believe that recovery of healthcare requires innovation and transformation. I believe, and I hope I've persuaded you at least a little, that compassionate leadership really does empower and create the conditions for change. And I think it's very clear, and there is a good evidence base for the fact that compassionate leadership helps staff, it helps patients, and it helps organizations. And in closing, I leave you with this. This is a book written by Michael West, which I would commend to you. And his final quote, "Compassionate leadership is inclusive and enables all to feel they have a leadership responsibility, ensuring the skills of all are harnessed in the delivery of high quality care." And that is, of course, what we are all about. So I hope that you've found that helpful in some way. I wish you well for the rest of your wonderful Congress, and I look forward to perhaps seeing you again in person at some point in future.
Thank you very much, Jackie. Would you like to speak a few words before we let you go?
Good morning, everyone. It is about 5 o'clock in the morning here, and it's still dark. You've just made me listen to myself, which is something I absolutely hate doing. So that shows how much I do love your college to put myself through that. But anyway, it's lovely to be able to join you virtually. Compassionate leadership is something I myself feel very passionate about, and I hope there's some elements of that you might all be able to think about. Having the courage to be kind and compassionate, I believe, is really important. So I hope I've persuaded you a little bit about that.
Thank you, Jackie, for that brilliant presentation. I think we have all learned from your presentation, at least I have. And I know why the current president put me here now as a moderator. And I can assure you next time when a trainee comes with a problem, at least I will listen, but I will give the judgment as I please. Thank you.
Thank you very much.